very visual. Oh, yes, recording is good. All right. Can you see my slides? Yes, I see.
Yes, perfect. Thank you.
All right. Oh, let me check. Yes. Let me move these. I have a lot of things here open to show and tell. So, okay. First, I want to acknowledge that it's not just my work. This is a team effort. And I wanted to acknowledge this list of amazing partners who were part of this process of developing this web tool, including Penny Hall herself, Brian Midman, Ross Glasgow, others such as Rebecca Langning Hall, Sarah Birkin, and Samantha Rubio, who led a lot of the user testing activities. Again, a little bit of background. I know I'm preaching to the choir. That's why you're part of this group. But for me, it's important to start here and in terms of aligning solutions or interventions to local context. Well, context, as you know, can have an impact on your intervention before, during, and after we implement them. But context also reflect the rich diversity, goals, and values of the communities we care about. So I know we know that, but it's so important to continue to try translating to, okay, that how do we keep in mind that? What will that mean for our efforts? So as I have mentioned, if you have been in previous presentations, I created this graph to kind of reflect that for our field, implementation science, D&I, and health equity, we both share this principle or value to be responsive to those communities, to their diversity, their needs, their goals, their preferences, their history. And that means to be responsive to these systems, communities, organizations, clinics, patients, families. It is important for us to acknowledge that these communities are complex, that we often face multi-level problems in the work that we do as practitioners or researchers. And that means we really need to think on multi-level solutions that can really align to the nature of and the richness of our communities. So for the past, gosh, at least 8 years, I've been working, very interested in working with this concept of complex or multi-level interventions. And as part of that, I've been very interested, and I have worked with colleagues, including colleagues here, on extending Penny Hall's work. She coined these terms of functions and forms. And we have been further developing these concepts and two ways of defining them. That's part of the editorial we're working on really aligning how we define them. But if you're not familiar with these concepts, in a nutshell, core functions mean what is it that the theory or framework is telling you how you're going to achieve change. You have to do A, B, and C. Those are your core functions. The purpose, procedural, structural, theory-informed purpose that of your intervention that is going to explain and allow you to change things, to achieve or explain change. And then forms are more flexible. So they're the activities, the procedure, the workflows, how you're going to deliver the intervention. And it's flexible because it should be tailored to local context, as I mentioned, to those communities. So those could be steps, procedures, workflows, as I mentioned. It could be strategies, implementation strategies, but I think we're not there yet. If we're conceptualizing strategies as an intervention, they also then will have functions and forms, but I'm not going to go there. Today, we can have a conversation about that. But in a nutshell, again, if we have multi-level interventions, they are comprised. One way of conceptualizing them is core functions. They must really be met across contexts. We all agree on the purposes of the solution. Is essential that we meet these purposes to promote change. However, the forms may vary for a primary care in rural areas, for a hospital, for clinics within schools, and those are the forms. And I included some references, citations, if you want to further develop the reading. All right. So again, this is really fast. I want to focus on this. You may say this sounds great, and I always struggle with this question. This sounds great, but how do I do it? How do I identify functions and forms, and how do I track them during the implementation of a program and or in a research study? So that's the origin and the motivation for this website and this web tool. We wanted to continue to work on this question to hopefully start providing some resources and answers. This is the landing page of the web tool, but I'll show you the actual web tool. We share in advance the link, also a QR code, but I'll share the slides and you'll have them. But I wanted to, before we dive into the web tool, I wanted to share a little bit how do we come about this product. Again, so it's not just me doing things, but it's more of a team effort with diverse views. So we implemented 2 phases of beta testing. And the first phase had 2 rounds of user testing activities during 2023 and 2024. Maybe some of you, I know, Ross, you were part of the testing. But for round 1, we wanted to introduce a very rough version of the website to just capture first reactions, to get suggestions of the audience. What type of content should we include? It's a web tool, so we're really limited on the amount of text that we need to include. Otherwise, it's not going to be usable or interesting to you all. So what we did was we invited a group of partners, colleagues, to navigate. That was a very rough layout of the web tool. And they navigated and they kind of orally spoke about what they were finding, where they got stuck. And we had 5 colleagues, and we wanted to have as much as we could representation from those who have never heard of functions and forms. We call them beginners or novice. Those who were kind of sort of familiar, and those who were experts. And the first phase, for example, Brian Midman was part of their first phase. So we focus on formatting, website layout, and main areas of content. Then we made some changes. We created a prototype. We made some changes based on that feedback, and we went back for round 2 after several months. And we started digging deeper into the content, the functionality, the navigation, user flow. And you can see that here we had 10 users, different levels, and we have partners from the US, UK, and Australia, including Penny Ha was part of that second phase of beta testing, or round 2, excuse me. I'm calling it round 1 and round 2. All right. So a little bit on what we're offering. Who is this website for? Our goal is to make this helpful to practitioners and researchers who are in the beginner to intermediate level. If you're an expert on core functions and forms, you may want to see different things here, or you may know already some of the things here, but that's the audience that we're hoping this will be helpful. Again, if you're novice or intermediate and you're curious, or you're starting to use these concepts, we hope that this web tool is helpful for you. I'm going to keep going. This is a handout that we'll have actually at the conference. So a little bit of the preview. We started with a little bit, hey, this is what we're trying to do. Here is how we define complex health interventions. And we really wanted to have as many examples as possible, applied examples. So that's what we started. You can see is priority at the front. And then at the bottom, you can find additional examples, but concrete tools. And I'll share with you those and how they can be useful to you. All right. So this is not the end. This is what we call phase 1 with 2 rounds of user testing. What is phase 2? I'm going to keep going for 2025 to 2026. I'm calling it phase 2. We wanted to continue refining these resources. and I would love your feedback on the good, the bad, and the ugly of what you find in these resources. Hopefully you can find these tools helpful for training and research. We want to continue to add more examples, including in the area of public health, as we keep building this tool, this website. And definitely my goal is to offer this website in Spanish and to do beta testing with the Spanish speaker partners and colleagues as well. And last, we want to continue dissemination efforts and learn from those using the information, learn from all of you if you use this web tool. All right, so this is one part of what I wanted to share. Any questions so far? Because now I'm going to move to the actual website.
Looking in the chat and nothing for now. So please proceed, Mónica. And please, everyone, use the chat for questions so we don't forget them.
All right, but I'm glad that was really clear, hopefully. So now let me share the actual website. All right. Yes, you can see my screen. All right, so this is the landing page. It's hosted by our University of Colorado Anschutz. You can see the title that we started Functions and Forms, but this is the name of our center. We're still working on the presentation at the top, but there are several tabs here that we couldn't move. So I hope this is not confusing. So here is the title of our center, Accords, and the tabs that you see here are really standard for all websites at our university. We cannot change them. So these tabs are not related to the Functions and Forms web tool. They are tabs related to our center, Accords. So yes, that's where we are. All right. So if you keep scrolling down, you will find the title that we gave it. We wanted a kind of an umbrella title, and it is really calling attention to multi-level and or another name is complex health interventions. We are focusing on health and healthcare, but complex interventions could be in any area. It could be in school, educational type of interventions or other areas, but we are focusing here on health and healthcare related interventions, including public health. And as you can see here, we want to offer how we define these interventions, key concepts, examples, and practical tools and resources. So the site has kind of 3 areas. You can click here on each of these buttons and go straight to each area if you don't want to scroll to kind of look at everything. If you want to go straight to the tools, you can click there and you'll go to the bottom or to the concepts of functions and forms, or you're still kind of curious if you want to start from the top. What do you mean by complex interventions? So if we start for the top, you can see as I mentioned, our tailor or the audience that we hope we can reach with this web tool. And key contributors, as I mentioned. So here is where we start. I work on this definition from 2019. I think I'm going a little bit blank on the year, from the J. Journal on Functions and Forms with Brian Midman and Rebecca Legning-Hall, where we further developed the definitions. So this one is informed by that paper, but also my conversations with Brian Midman, Penny Hall, and individuals that you saw there as contributing. We wanted to make it just bullets, so you can see here, what do we mean by complex health interventions? And we present here saying, well, thinking in terms of interventions where you see all or most of these characteristics. For example, have multiple components that interact with one another, require coordination among different teams, individuals, require flexibility and how they are implemented. They are dynamic and they adapt over time because they have a lot of, they are influenced by local context. and they interact with each other in local context. So a few of the characteristics that you might think, okay, do I have a complex health intervention, or perhaps not? And then we follow with concrete examples of complex health interventions. So if you click here, I want to take us to the pragmatic tool. So I'm going to keep going and go to the bottom, and then if we have time, we can come back here. But this is an example of a project I've been working on for several years on psychosocial screenings in primary care. More specifically, adverse childhood experiences through an IMH pilot project that was funded in California. So if you click here, I describe this project and why I'm arguing, and funders agreed, since they funded it, that this is a multi-level complex intervention with a checklist. Then here I am pairing it with the bundle implementation strategy to support those screenings. And you can see the example here as well. This is more on the primary care kind of clinical area. We are working on adding examples on public health. And if you have one, I would love to hear from you. We can post here as well. But my goal is to have public health example health in terms of the intervention and the strategy to pair the two aspects of the work we do. We picked 5 resources for further reading and key groups. There are so many, but we didn't want to have a long list. We wanted, with agreement from those colleagues who were part of the user testing, we agreed that there are 4 groups that we wanted to highlight. Again, these are not the only groups that have worked in this area. You might find their work and efforts helpful. One is the Cypher. The Cypher is a team in Cardiff University in the UK, and they work, everything they do is in terms of complex interventions, a lot of work in the school systems. We also have NCI's Consortium for Cancer Implementation Science, CCIS action groups. I am the vice chair for the multi-level interventions action groups with an amazing team of partners. If you're interested, we'd love to have you. But that action group is specifically for complex interventions. We have PCORI. PCORI has a whole area on, they developed standards for studies of complex interventions. You can find the link there. Please check it out. Brian Midman was part of that development of those standards. And you can see the UK framework on complex interventions. So the UK has been leading work on helping us think and conceptualize this type of interventions. This 4th link, list of readings and references, is a Word document with a long list of papers, reports, publications that you can open and give you even more information. But again, just a few groups and resources that we wanted to highlight here for further reading. If you continue working, so we started with what's a complex intervention, some examples, and then, hey, you want to read further? You want to learn from other groups focusing in these areas as well? Here are a few links. And then we dive into the concepts of functions and forms. There are 2 concepts from complex systems thinking that can help you conceptualize an intervention's change process and its delivery in local context. So here are short definitions on functions and forms, similar to what I shared in the slides. So first we define them, and we offer examples, again, trying to keep it consistent, a clinical example on public health, content to come, but in the clinical example, what's an example of functions and forms in a project we have worked on? And you can see as part of our P50 funding project with Russ and others, we developed an integrated actionable aging assessment for cancer patients tool, where we apply these concepts in our early work. So if you click there, you can see a description of the project, and hey, this is how we define and use these concepts of functions and forms. So again, we're trying to really pair a lot of examples as we go. What is it? How do we define it? Give me an example or two for each of the areas. Then at the bottom, going back to that question on my slide, this sounds great, but how do I use these concepts? How do I track them? What resources can you offer me if I'm interested in incorporating these concepts of functions and forms in the work I do? Right now, we're offering 3 pragmatic tools, hopefully pragmatic or usable, but 3 concrete resources we hope you find helpful. The first one is the functions and forms matrix. This table is already included in the JGIM Journal General Internal Medicine, in the apply to patient-centered medical home care. So we just wanted to offer ways for other teams to have a little bit more guidance on how to develop a matrix. And let me show you what I mean. So if you click here in functions and forms PDF, this is an editable, you can edit this PDF and map your interventions needs, core functions and forms with your team members. But also we offer instructions if you want to do a formal literature review or narrative review to inform that matrix. So pragmatic tool or tool number 1. Did they change screens? Do you see kind of a word? Yes, right? Okay. All right. So I promised you I was going to show you matrix, and first thing you see is more text. Why? Our partners during user testing really wanted us to offer steps kind of in a nutshell. Tell me, before you show me the matrix, tell me how to develop that matrix, but tell me in a short snapshot, kind of a very short, how do you do that? So that's the first thing that you find here. A little bit of background, what I mentioned, and the steps. Identify the who, identify local needs, they identify the why or your core functions, and then identify the how of those forms, and a little bit of information on those steps. So this is our effort to make it concise with 4 general steps. Of course, there are many other things that happen in between. And then you can see the matrix in different formats. So for the matrix, you can use this PDF document to bring together your patient partners, community leaders, physicians, nurses, patient navigators, other researchers. And for the intervention that you are developing, you can ask these questions to within the group or individually. What is the need? What is the problem? Why do we need this solution in our fill in the blank? School, clinic, community, hospital. So it's fillable. You might add different ideas here, but you can add text such as increase patient engagement in some area. Then here is an area based on those suggested steps on identifying the core functions of your intervention. Again, it's fillable, you can add text, and you can develop those core functions based on the theory and framework for your intervention, but really refining it with your partners. What will that mean for us in terms of those core functions? The third column is even heavier and in terms of the input that you need to get from your partners. Because this is okay, how are we going to deliver these specific core functions? What will be the activities? What will be the steps or procedures? So you can list them here for each of the core functions, and here add any comments or notes that you want to add based on that group effort, or your partners can do it individually. You can print it. That's how I've done it in community-based clinics in California. I printed it and we completed together by hand. So this is one format for the matrix. And the other format that I call Fiesta, and I want to thank Rose Prieto in our team who helped me develop these formats, but this is more exciting. I just found an issue here. So it seems like if I complete there, it's going to automatically populate here. So good to know. So very similar, but different format with notes. again, this is a way of you to work with your teams using this table, following ideally to inform the steps that I mentioned there. And then here is a more detailed definition of the methods. Step one, identify the who to bring to the table to inform your matrix. Then, as I mentioned, the needs, suggestions on how to do it based on our experience and the literature, the why. I provided an example there of theory informing the PCMH table, then the forms with some more information. And here I added this area, which is you can inform this table by conducting a literature review. But after the years, I have been mindful that depending on your time and resources, you might be able to conduct a 3-year systematic literature review, or you might have a couple of weeks to do a relatively rapid narrative review or check out a few publications. So that's what we call top-down approach, what's out there in the literature that you can bring to your own matrix. And here are different suggestions for you how to approach that. How do you narrow sources? How do you analyze those documents? How do you refine the matrix based on what you're finding? And here is the example of an actual completed matrix on PCMH. You can find this table in the citation. It is published there in the journal. So please do not reproduce. Go back to the journal where you can find the table, the completed table, and a few references here. So that's the first tool. Again, it's all about developing the matrix that we initially presented in the JGIM publication, but without a lot of guidance on how to do it. As you can see, there are steps, short steps, 4 steps on how you can go about developing this matrix with your partners, and then a more detailed explanation walking you through each of those 4 steps. But I added a whole section on if you want to inform the matrix by a literature review. Here are some suggestions, but again, I acknowledge that it depends how much time you have, how much funding, and where are you in terms of the trajectory in research. So this is number 1. Again, if you use it and you find any glitches, perhaps I just found one, please let us know. This is still phase 1, and we are still learning and how this is working in the field. Resource number 2. So here we have a matrix, and in my work, this reflects my work and also input from colleagues. But in 2017, I did a lot of work with interviews with federally qualified health center clinics in Southern California. And I developed an interview guide that I wanted to align with the matrix. So something that I did, you might find helpful when I inform this matrix with clinical partners. I also did it with caregivers, but with clinical partners, we started from right to left because we found that it was for some clinical partners, including, for example, schedulers, they had a hard time identifying the columns on the left, which could be an issue in terms of why are you doing that? Why are you calling patients 3 times before they come to the clinic? In terms of the motivating need or problem at the clinic level and the core goals or purposes for their actions, they had a hard time articulating these. But they knew, sure enough, they knew what they were doing that day, before and after the interview. I'm calling patients 3 times. I am entering X amount of data in the chart, in Epic, for example. So if you work with your partners, you might realize that, and what are the implications that some partners seem to know more of the forms and less of what is the whole complex intervention areas that they need to know. If I'm calling patients, how much is helpful to know why I'm doing this? Why is the change that I'm trying to contribute to? And what is the motivating problem? versus not having a clear idea of these two areas. So again, it can be used as a tool even for learning within systems. Clinicians have a much better, easier time and completing the table than support staff, schedulers, patient navigators. So those were great findings that I work on during the pilot. So after working with partners, developing this tool, this matrix, as I mentioned, I wanted to have an interview where I could dig deeper on, including what I found. But I wanted to also have this as another way to track and understand and assess functions and forms and the complexity of these systems. So this is an interview guide. Please feel free to adjust. It can spark ideas for your own. This is not the interview guide. It's one way that I have field tested it. And you can see there are some questions in terms of overall implementation, a lot of what we do. Tell me about the intervention in your own experience. What are the main challenges? What's going for us? We do that a lot. I am challenging some facilitators. I'm looking at the time. But then I broke it into a table with concrete questions that are aligned with each of the columns of the matrix. Again, as a way of you completing a matrix, it's a snapshot, kind of a roadmap, but with this interview guide, hopefully you can dig deeper on each of those columns and you may choose to do it before the matrix or compare with the matrix on an ongoing basis and inform, update that matrix. So a little bit of contextual fit here with a few questions. And this is resource number 2 in terms of an interview guide. And I know I'm running out of time. And resource number 3, we have used in our work, again, with community-based clinics serving diverse patients, many underinsured or uninsured, and with very evolving contexts in terms of healthcare policy, funding, very dynamic context. So with this tool, we have done it with an Excel table, but for presentation, we put it in a PDF file. And this is a tool that hopefully it will help you. We have used it to track any evolution in terms of prioritization of the core functions for a hybrid study, and I'll show you why, and any adaptations to those forms. So we implemented this tool through ongoing coaching sessions with the clinics as our strategy, where we brought a little bit of date, role by attendees, project name, and here we included, okay, here are the goals. This is what we're doing this. In this case, ACEs screenings. You can have the field completed or just ask them if they have a clear idea, what is the goal of the intervention? And then here, these are our strategies. Of course, you may choose not to say implementation strategies. I usually say, here are the things we're doing to make it work for you in your clinic or for you in your community. But here is the goal of each. Why are we doing this? So we will have a discussion on that. And then I found it extremely helpful for their sense of ownership and to catch evolving context as we go. We did these coaching sessions every 5 to 7 weeks or as needed with each of the clinics for this R21. But we asked them, is this goal still relevant for you right now? Has anything changed? And we started with a simple from 0 to 5. What do you think? It is no longer relevant. 2, but we started checking numbers and see if they were changing over time. From a 5 to a 1, this core function is losing priority, and that could be a problem for the integrity of the intervention or not. So these are things that you can at least track to discuss with teams. And here, how do you achieve the goal? How do we make it work for us? So here we started to track in terms of forms. So here I will have the activities already listed, or I will ask them, what are you doing? To see if we match with our plan, to see what's actually happening in the field. And a little bit of tracking on adaptations, how well it's working from 0 to 5. Have you made any changes, yes or no? What was changed? And a little bit of notes. Why did you make the change and who made it? So again, this is tool number 3 that you can use on an ongoing basis as part of a coaching type of a strategy to track adaptations, which are incredibly important. Because remember my argument that these are multi-level interventions that are dynamic, interdependent within their own components, and interdependent with dynamic context. So this tool has been tested, as I mentioned, in the field, and we found it to be extremely helpful to have something concrete to talk about these rather abstract concepts. Functions and forms are abstracts. So this is our goal, to bring down these abstract concepts into concrete tools that we can use to identify functions and forms and track them with our partners. All right, so that's the end of my show and tell.
Fantastic. Thank you so much, Monica. Very rich content, and I am so grateful that you are contributing to the field in such meaningful ways and helping us understand these concepts better. I am right. I'm going to jump right into the chat because there are a number of good questions. And I wanted to start by inviting Julia. And I don't know, Julia, if you're in a good position to
Great.
unmute and ask your questions, or you would like me to read them.
Sure, for Scott, I can unmute. You can hear me?
Thank you.
Awesome.
We can hear you very well. Thank you, Julia.
Monica, this is fabulous. Really, really exciting to see things coming together. And I love that the field is building concrete tools for people. We know that that is definitely what people are asking for. So kind of 2 related questions. One is, we find that the concept of forms and functions has been very hard to explain to people, harder than many other implementation science concepts, and that virtually no one we have talked to has been able to understand it by reading alone. They needed someone to verbally explain it to them. Have you encountered this, and have you thought of building a video? That's my first question. And then part 2 is, in explaining it verbally, we have found, and research shows, analogies or stories help people understand these complicated concepts better. And we have struggled to find a great forms functions analogy. And I wondered if you had thought of anything like that.
Hi, Julia. So great that you're here. I know we're going to chat during the conference, and I know you and your team have been working in the same area, how to develop checklists and resources. Great question. So in terms of the video, Ross has mentioned it. You need to create a video. So we need to do that. Yes. Even something like this presentation where I can share a little bit more live in a video. So I'm going to work on that, creating videos. Yes, it's part of the work. Let's do it. There are different ways of learning, and many of us might prefer a video. So I'll work on that, Julia. I would love your feedback as well. Stories on an analogy. That's a good point. A while back for DNI conference, I presented a poster. This was like 7 years ago when I was starting to work on publishing, and maybe more, with Brian Midman. And I presented a figure of a car in terms of the engine versus the kind of the windows, the painting. I thought it was pretty good, but I got a little bit of pushback of, no, that's confusing. What do you mean? No, in terms of functions and forms. That's as far as I have gone. Every time I think of something, it creates more confusion. So Julia, I don't have an analogy yet. If any of you come up with one, we have a raffle of $500,000 on that as a prize. Just kidding. But it is completely agree. We could visualize functions and forms with a picture or a story. I completely agree that it will be very helpful. Again, the longest I've gone is a car in terms of, all the engine and how it works versus more of how to make it work for me. Do I need an SUV or a smaller car? What color? Things like that for the forms. Did I answer your question, Julia?
Yeah, awesome. Well, I will keep you posted, since we will keep thinking also about forms and functions.
Yes. Yes, and Rose mentioned a brief video or short story. Thank you. Yeah, my wheels are turning. One of the findings in one of the projects that I mentioned, where I work with rural clinics in eastern of LA in California, was that they were applying a lot of forms that are not documented and not even well known by managers, but they reflect such a creativity and innovation, and we're losing all of that. because we don't have a way of capturing a name, tools, and it's not included often in our research. So maybe stories like that, and I have a table of what PCMH nationwide is, what we found from the literature in terms of menu of forms, and the incredible ways that clinical partners make it work with limited resources in the field. So stories like that might be helpful. Thank you for the suggestion, Julia. And Elizabeth mentioned the matrix could be used for intervention development. When we got to the interview form, which is helpful, it looked more for understanding an existing intervention. Good point. Okay. Do you have thoughts on where form and function overall fits with intervention development and or implementation? Thank you, Elizabeth. Such a great question. How we started this work was on, I think the matrix can be very helpful when you are refining or co-designing an intervention and when you are co-creating those strategies with your partners. And why I'm mentioning that, if you already have the matrix completed, you leave little room for your partners to interject, especially what are the core functions that are priorities for us. And I have learned over time that for some communities, some of the core goals or purposes of an intervention might not be a priority for them. And perhaps we run into trouble because they might not then implement an area of our solutions because they don't find that it's a priority for them in that purpose or goal. So it's always so helpful to check with those implementers and those invested partners, patients, community leaders. So I will say that these tools could help heavily during the planning, pre-implementation, where you are either co-designing, refining, and or co-creating with your partners from a very participatory approach on how you develop this knowledge. It can also help, I have used the interview to better understand context and to identify heterogeneity in terms of folks doing different things and having different goals. And that, again, could be a problem when you are trying to test an intervention. So the interview was very helpful to help better understand context, and you can use it at different points. Pre-implementation, helping you understand context, during implementation, and or at the end, and when you really want to start with dissemination and sustainment. Those will be my thoughts, but great question to keep pondering. I know we run out of time.
Yes, I was looking at, there was, I think, one more question from Lydia related to effectiveness. We have not addressed that yet, right? We have a minute. Lydia, why don't you ask it very quickly, and then we can see whether we can get a half an answer.
Yeah, thank you for our presentation. I already envisioned myself using the material in my implementation research. My question is, what is the relationship between effectiveness and core functions?
Very good question. So from my perspective, I know some colleagues may disagree. We still don't have consistency, even how we define these concepts, and that's okay, right? We have learned that in D&I. But I have close conversations with Penny Hall, and I'm respectful that she coined these concepts. She, among others, have coined fidelity to function. So in terms of effectiveness, that is closely related to the core functions. Why? Because they are theory informed and they explain the mechanism of change. And that's what we want to assess efficacy or effectiveness. And that helps us with external validity. Why? Because we should have the same core functions if I'm in a rural area or if you're in a big city like LA. We really need to agree on what is the general mechanism of change, what are our purposes. But the forms are more related to adaptations, to tailoring, to customizing. So the delivery, the implementation and sustainment is higher over time in the long haul. That will be my answer in a nutshell. Part of the editorial with Borshika, Ross, Penny, and Brian Midman is to really explain in a randomized control trial, how do we incorporate these concepts? So we we're working on that. But great question, Lydia. I hope you find it helpful.
Thank you so much. Thank you everyone for being here. Mónica, this was fantastic. I really appreciate all of you. I will see you, some of you in, well,